When 2-year-old Mason Eichert caught a cold from his sister, his parents, Debbie and Steve, weren't too concerned. But when his fever spiked to 106 and he began having convulsions, they rushed him to the emergency room.
We had never experienced anything like that before. They explained to us that it was fairly common that when a temperature goes from 98 to 106, that a child can go into what they call a febrile seizure. And they sent him home.
The next day, Debbie and Steve followed up with Mason's pediatrician.
They sent him down for x-rays and to get some fluid because he was dehydrated. And discovered that he had extensive pneumonia on the right side of his chest.
His parents were told once again not to worry, and Mason was put on antibiotics. A few days later,
Mason started turning really pale. We couldn't get anything down him.
He got more and more lethargic. He wasn't moving around. He wasn't playing.
They took him back to the hospital. Blood work showed Mason's platelet count was less than 1/10 what it should be. Dr. Michael Vish was on call at the time.
The pneumonia wasn't in and of itself the thing that was worrying me the most. He had a few other subtle abnormalities in his labs that were telling me that he was developing a kidney problem. It was a condition that can follow pneumonia sometimes, and it's called the hemolytic uremic syndrome.
Hemolytic uremic syndrome feeds on platelets and destroys the red blood cells. There is no cure and no treatment.
I then asked Dr. Vish again, I said, what are we talking about? And he said, your child is very, very sick, dying sick.
By the next morning, Mason's platelet count had dropped even more. His kidneys failed, and the disease was spreading to the rest of his body.
They were setting him up to give him a transfusion to stay ahead of this disease and to then purify his blood with dialysis so that other organs wouldn't fail.
Mason had a severe lung infection, but until his platelet count rose, the surgery to remove the infection was too risky. If they operated too soon, Mason could bleed to death. All anyone could do was wait and pray. 3 days later, Mason was stable enough to go into the OR.
About 3.5 hours later, the surgeon called and told us that everything looked fine.
Suddenly, everything wasn't fine.
Any available surgeon, please report to the OR stat.
And I asked the nurse, I said, do you think that's for Mason? And she said, I don't think so, but I'll check. And about 5 minutes later, she didn't come back, and I hear it again. And I look over at her, and she just went white and turned her face from me. I knew something was desperately wrong.
We were praying together and holding each other, and all at once, his primary intensivist that was working on him walked in and took a knee in front of us. And when he took that knee, my heart just dropped to the most bottom part of my body.
And he told us it was worse than he thought. That Mason bled out, and his heart stopped.
Mason's heart didn't beat for 18 minutes. After he was moved to recovery, Steve talked to the surgeon.
I could see that he was choked up. I said, so what happened? He said, I don't know if you want me to be that graphic, but I said, I want to know what happened. And he said, I had to manually reach in his chest and pump that hard to keep the blood in his heart.
That afternoon, Steve discussed the situation with his brother.
I asked him, do you think that Mason's going to die? And he broke down and got extremely irritated at me and said, if Jesus wanted this boy, he'd have been taken. If you can't see that, then you're just blind here, because it's way, way bigger than you and I, and your planning is worthless here. What you need to do is fight with this boy, and we need to pray and focus on him, because Jesus Christ hasn't given up on him. It was almost like just a rebirth in my mind and my heart. I walked into the chapel that night, and I said the Lord's Prayer, and then I just said, if you want this child, he's yours. He was your lamb before you gave him to us, and if you have to take him, then take him. Because I can't manage it anymore.
Debbie was also looking to God.
When his heart stopped, it seemed like no matter how I prayed, he wasn't hearing me. And not until, I guess, he came out of the recovery room and was on a vent, did I hand Mason over to God and said, I don't know what else to do. If you want him, take him. He's your son, and let your will be done.
Although Debbie and Steve's spiritual outlook had changed, Mason's condition had not.
He actually had a multi-organ system failure, and when you put all of that together, he certainly had a less than 20% chance of surviving all of that, based on the medical knowledge that we have.
Mason's dismal medical prognosis intimidated everyone. Everyone except his 4-year-old sister, Brooke.
When my brother was sick, my grandma was really worried, and she's like, if Mason's gonna live or not, and she was dreading all the things that he had, and she was worried if he would die. And then I said, John 15:15, ask anything in his name, and it shall be done.
3 days later,
his kidneys started working. And on the 5th day, they took him off the vent, and Mason started an encephalopathic cry, which is an uncontrollable, inconsolable cry. They took him down for an MRI and discovered he had 12 strokes.
the strokes affected the parts of Mason's brain that control mobility and sight. Doctors warned the Eicherts that he might never walk or see again.
We believed that nothing but Mason's 100% recovery and healing. So we kind of just nodded at him and said, okay, well, whatever it is, and we'll take him.
After 9 weeks in intensive care, Mason was transferred to a children's rehab center. Still blind and unable to move or speak, Mason had to be cared for like an infant. He made amazing progress and regained 100% of his vision. Mason also learned to walk again. By the time he was released from rehab 3 months later, Mason was running and playing like any other boy his age. Today he is a thriving preschooler. Dr. Vish recalls seeing him for the first time after his ordeal.
I didn't recognize Mason. That is, I didn't look and see a sick kid. I saw a happy, well child, and I had to look at him hard and think, wow, this is the kid who went through kidney failure, who went through respiratory failure, who went through CPR, who, quite frankly, at a certain point, I really didn't think was going to recover well.
When you saw him and the progress he made within weeks and months, and from a stage that I thought would be, I hate to use the word, practically a vegetable state was what I would have expected. To see him today, it's nothing short of a miracle.
God can move mountains, and we've got proof that that's absolutely true.